Thank you. I'm really happy to be here today, and I've enjoyed being able to listen to most of the panel over the last day and a half, even though I had to step out periodically. So in terms of what we understand about the public, I think that our experience with COVID has highlighted that there are a lot of gaps in knowledge. And I would say that one gap that we need to address through future research is actually around public perception and knowledge of respirators. And I don't think that amongst the general public or amongst workers who don't wear respirators on a regular basis, we know a whole lot about how much people know about how respirators work, what they think about respirators, whether I have negative or positive perceptions of their performance or value or how it makes them look or how it makes them feel when they wear a respirator. I don't think we really understand the context in which people are willing to wear them. I think that, as mentioned by one of the panelists, in certain areas of the country, we see high compliance and interest in wearing face coverings, but that is not the experience in every community. And clearly there are motivating factors that influence how people want to wear face coverings and respirators that we may interpret as a political response during COVID, but might be from a variety of other personal values or perceptions. And so we don't necessarily understand in what context people really would be willing to wear respirators. Clearly, you get people wanting to wear face coverings and respirators in the context of wildfire smoke exposures in certain communities in response to COVID. But in terms of how they use them around their homes while working on projects or construction projects at their own homes or in other hobbies or contexts, I think we don't have a lot of understanding about that. And so I would say that characterizing this user group is an important research gap to move us forward so that we can target messages and target designs to help them facilitate their respiratory protection. I think that there's a couple of other aspects related to how respirators are designed and used that are areas that we need further communication and education and research about how to do that effectively. We've talked a lot about today, other panelists have talked about the exhalation valves, and that is, I think at this point, really driven by a data gap that can be filled by research and communicated pretty straightforwardly to the public. But there's other things that have come up during COVID that represent failures of communication in how respirators work and what they're designed. So, for example, the YouTube videos that were mentioned yesterday about trapping carbon dioxide inside of respirators. I mean, you can address that with evidence, but even in that case, we have a very reasonable explanation for why you can see that carbon dioxide present in the face piece, but whether or not how to communicate better to the population about what that really means. There's also been news reports and concerns related to the chemical content of respirators, either that there's something in the material or a disinfectant material that could impact the wearer, and whether or not those things are true or it's a perception and a fear that is impacting the general public. And I think what's something else that's been discussed a lot is the need for respirator fit. So there were comments earlier today about trying to move towards respirators where we can have a more universal fit or be more confident that more people will be able to fit the respirator effectively. And so I think that there's a lot of needs to communicate around what is the value of the fit of respirators, including things to the effect of the frequency and impact of having an ill-fitting respirator, the frequency and impact of health conditions that people may have and how that might impact their ability to effectively and successfully wear a respirator or comfortably wear a respirator. And so I think that that's another theme where we need to do a lot of public communication and research about how to address effective communication along those themes. And this shows up in various ways in the conversations we've had today about exhalation valves versus surgical masks and the trade-offs that people are trying to balance between those things, and why a surgical mask is not equivalent to a respirator that has an exhalation valve. I think some other aspects that have come up that relate to communication to users is around respiratory protection programs. When you read the OSHA standard, it seems incredibly complicated, I think, for a lot of small organizations to figure out how to implement something like that, where they might not have a lot of other kinds of occupational health and safety programs in their workplace. And so I think that there are things that we can think about in terms of research questions about how to communicate what a respiratory protection program means in practice, how it can be efficiently implemented, how to evaluate its benefit, because we know that many workplaces that have these programs don't implement them effectively. And so this has a general value, but I think that communicating to a small organization, a small employer, or an employer that doesn't have a lot of formal health and safety programs, what really is the key things that need to be done that really drive the effective use of respiratory protection in the workplace. And so that's where I would like to conclude my comments in terms of the themes that we need to better understand what the public knows and perceives about respirators. We need to identify research and evidence to help us communicate around specific gaps in knowledge that are clear, and how to make respirators and respiratory protection programs more adoptable and less threatening for smaller organizations.